Thank you, and so so that's what as a president of All India Ophthalmic Society, I made this we did about 3,000 camps in the November, and thanks to Dr. Subodhi, who is also doing a lot. So the diabetes mellitus is now the epidemic of 21st century, and this is what we are trying to educate people. And teleophthalmology is the important thing where we can create awareness, screening, and also make the patient come for treatment. So it's a major cause of blindness in the working middle-aged population, and fifth cause blindness globally. And the IDF says 537 millions are having diabetes. And actually, right now, Lancet has published we have 101 million diabetics as of now in India. 58 million do not know they have diabetes, and that's where we are working in our Mumbai slums. And we have only one ophthalmologist per 100,000 published in Indian Journal of Ophthalmology. And 70% of the Indian population reside in rural area, low awareness or ignorance, and thirdly, follow-ups are required once you are diagnosed. So the technical difficulties which a problem in India is unreliable internet coverage, deficit in supply of electricity in many areas, shortage of trained medical staff for operating conventional fundus camera, and portability of conventional fundus camera. So these issues can be solved using a computer machine learning AI for analysis of retinal images in people with diabetes, thus solving at least some part of the problem, which is again published by the AIMS Atul Kumar and group in 2019. And AI, the intelligence is the capacity to analyze, think, make a decision, and categorize. And artificial intelligence involves formulating a specially made algorithm according to our needs to develop this capacity and include it in an electronic device like smartphones. I saw this in 2017 in Ahmedabad in an diabetes conference, and that's how I picked up this. And then we got the AI integrated into which can perform fundus photos, identify fundus feature, classify image, classify existence and severity of the disease based on tableting. So the idea is to screen, diagnose, and treat. In cancer, if you screen and diagnose, and if you don't treat, you are punishable according to the Indian Penal Act. In diabetes is not there, so morally, I think all general practitioners, diabetologists, and optometrists, ophthalmologists have to be involved for not only diagnose, you have to make sure the patient comes for treatment. As a part of our NAT study, we had a problem. Patients are not willing because they said, my vision is good, why should I get a laser done? So we need more working hands, and we have to use a minimally trained staff, and we arm them with AI, and that's what we have done. We have made a pre-camp awareness, assembly of diabetics, capture of images, and diagnosis can be done by AI, ophthalmologist, and then so we work with Remedio, again, no financial interest, and I don't know whether they become industrial partner. Dr. Subudhi and me are trying to kill all the manufacturers of the various teleophthalmic instruments for becoming industrial partners so that they can pay money and also be part of it. And instead of promoting them, we want to promote that using any of the equipment we can screen. So here we have used non-skilled health worker who are working, who can school dropout. They know to use the smartphone, and then they have been trained to use AI, which is deployed on a smartphone and using in the municipal dispensaries from 2019. And the computer is trained to accept retina pictures, and then that labels as this is how the iPhone is attached to the infrared device with an adapter. It can be mounted on a suitable bike, can be mounted on any table, and it's chargeable. And this is made by Forest. As I said, I'm not supporting any company, but I want technology to reach every village in India. We have 6,47,745 villages in India, and you can see my late grandmother and late father who inaugurated this van where we carried the motorbike, the camera in the motorbike, and this is what. So you can see this is we can carry this thing in the motorbike. The reason is by sending a non-technical person, that's important because we don't have to waste the power of ophthalmologist and optometrist. And this boy is a 9th pass, and this hardware is in the box, which is kept in the, thanks to Forrest who made this for me in 2014, and we inaugurated on March 1st, 2014. Which I saw it in Agra All India conference. And this is you see the bumpy road. We can bring this sort of cameras which will not be affected in. If you take a Zeiss or Topcon, the whole optics will go, and you can see this guy takes wonderful pictures, and then AI can say this patient needs to come to the center for referral or for treatment or not. And usually if you diagnose 100 patients, you will have only 5 patients may have to come to the clinic. And we want to target that 5 patients so that with a good vision, and we have a retinopathy, and then we can use them for anybody can screen for diabetic retinopathy. In all these pictures, whatever you see, if the fovea is not involved, the patient will have 6/6 vision. Does not mean his eyes are all right. So that's why we have to use the Tele Ophthalmology to bring the patient for treatment. And we also did a Guinness record where we are using this Remedio camera. We can see that all of these guys can take excellent pictures, and you can see this optic disc. And now this Remedio has come out with the 3 diagnoses: diabetic retinopathy, glaucoma, and age-related macular degeneration with one. And this Medios is the software which is incorporated in the mobile phone. The blue thing which is identifying the discoloration in the retina, and with the base images in the mobile phone itself. We don't need internet. So that's why in 10 seconds the phone will diagnose and tell the man that this patient needs to be referred or need not be referred. And the rest of the 90 people or 95 people can go, and every 6 months they can have a retinal checkup, or every 1 year, and also get the diabetes checked. This is a comparison on fundus on phone with size, and this is the AI which covers and classifies the diabetic retinopathy and sends the patient. So this can be the link between medically underserved area and tertiary healthcare services. So we can have physically somebody going, but transmitting the images to the center. Later, all these images can be kept in a data server, and which can be used and analyzed by the ophthalmologist, by the epidemiologist, and then also for follow-up. And that's how this program Stop Blindness as an AIOS initiative was done. We made a public interest movie inaugurated by Vijay Amritraj and Andre Agassi, the tennis players. We came in the Guinness record. 649 patients where we assembled and did the screening. 53 needed treatment, and we treated them free, and that's a record created. The idea is to create more, and then this is a research question we asked, how to use the AI, and then 100% sensitivity, which is published in JAMA in 2019. And the American Academy courses said this is the future, but I'm happy to say we are leading the world by doing this in India, and with more patients in the IGO. And then this is what we want to use, and also working with the various endocrinologists and other physicians to comorbidities can be diagnosed in the same patient, so that we can help the patient to live well, see well, and also live happily. And every day I quote our Rakesh Junjunwala, who died of, actually the paper said a heart attack, but he actually died of diabetes. And what is he created a wealth of 45,000 crore, but he could not enjoy it, and he was in wheelchair when he went. So by doing the diagnosis early, refer by the eye doctor, and then refer to the other specialties like cardiologist, neurologist, and for foot and renal specialists, we can prevent them from spending a lot of money. Early referral of the diabetic patient, greater care for the for the eye, timely medical surgical intervention to prevent complete loss of vision, and we create job opportunities. We don't need the UP police is there, Romeo police, we don't need them, and we can develop skill development in the less educated. And that's why I made a foundation to do this, and this is what we want to reach 6,47,000. We are now doing with all the, this is what we educate the patient, that diabetes affects the body, and through the eye we can diagnose. And so this is the last slide. I think AI is likely to be the best or worst thing to happen to humanity. It is up to us which one it's going to be, and we have to be the master of AI, as Stephen said. We have to make use of it, and then teleophthalmology will be the. So this is what the 3 slides we brought in that movie. So I think using AI, using teleophthalmology, we can prevent not only blindness, we can make Indian people live well. If we diagnose from the age of 40, they can live till 80 healthily with a good vision. That means they'll be contributing to their own income, thereby per capita income increases and GDP will increase. Thank you.
Thank you, Dr. Natarajan, sir, for your nice presentation. You're always traveling, doing a lot of good work. Hardly we see you